Today on Town Hall.
It used to always be something that someone like you or I were having meetings in the background about this vendor or that vendor around very tiny subsets, improving breast cancer detection algorithms with a lot of radiology type stuff. Now we're talking, how does it encompass everything in healthcare?
My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Our Town Hall show is designed to bring insights from practitioners and leaders on the front lines of healthcare.
Today's episode is sponsored by Meditech and Dr. First.
All right, let's jump right into today's episode.
Welcome to Town Hall, a production of This Week Health and Al's AI Insight podcast. I'm your host, Dr. Al Villarin. For this session, I'm honored to be joined by Dr. Kendall Wyatt, who is working as an informatics consultant and has had a multifaceted career working with startup technology companies and as a chief health informatics officer at Vandalia Health, Elsevier author and reviewer, academic content director, and a YouTube author. Kendall is an MD, RN, EMT paramedic, and a board certified in clinical informatics and internal medicine. On a personal note, Dr. Wyatt and I met while attending the CMIO Oracle Cerner Physician Informaticist Leadership Development Summit a few years ago, where I learned how influential he is for our innovative care delivery future, especially as we guide the integration of artificial intelligence. In this session, we'll explore the principles of leveraging AI as clinicians and informaticists. I want to welcome to the podcast, Dr. Kendall Wyatt.
It's great to be here, Al. And what's so funny is thinking back to when we did meet, I seem to remember it was not just a meeting, but didn't we actually have to be separated because we kept talking about all of the other cool stuff on the side, if I remember?
Absolutely. We became too advanced and it separated us for the good of the rest of the meeting.
It was fun. You two on the side. Just came back in and we had been reassigned seating, which was fun, which was a great thing and has kicked off a great relationship over the last couple of years. So great to be here.
Thank you. It's a pleasure having you part of this discussion. So let's get right into it. Beginning with your role as a technological interventionalist in healthcare, how has enabling AI technology changed your and our careers for the better?
I think that it's changed is maybe what is changing, right? So there's things that have changed because there's already so many things out there that we actually don't know about. So many things in radiology, so many of these other things where AI is being used or improving interpretations and augmenting background things. But what's bigger is that it's changing things now and what it's going to change in the future. I think we've got lots of talk that's going on now. Everybody's aware that it's happening. It used to always be something that someone like you or I were having meetings in the background about this vendor or that vendor around very tiny subsets of improving breast cancer detection algorithms with a lot of radiology type stuff. Now we're talking, how does it encompass everything in healthcare, not just this tiny little specific thing, but now how does it affect everything in care delivery across all spectrums, which makes it great, but also overwhelming.
Excellent point. I agree. It's accelerated so fast that it's really overbearing for all of healthcare, not just us informaticists, but healthcare in general has to evolve rapidly to keep up with the potential that AI can deliver for us, our patients, and our operations leadership. They rely on us to guide them through this process, and it's an important part of our everyday practice. You spend a lot of years explaining complex clinical topics on fun educational YouTubes. I had the chance to review some of those. Were great. You've made it very simple, and I wish I had those videos when I was learning this material back in medical school. But how has your experience in education made you such a superb clinical informaticist?
I think as doctors and nurses or anybody in clinical medicine, we love to teach. But being able to take that and put the personality behind it, and I always talk about my expressive face, my YouTube face, but it's let me break things down. It's made me more of an expert of breaking things down into bite-sized pieces and comparing something that's unknown to lawyers, right? to hospital administrators, to CEOs, to break it down into bite-sized pieces, but also create comparisons of something known to something unknown. So what is AI? And everybody always thought it was a scary something they're never going to hear of, then it came and it came fast. And now they could see it and they could feel it and they could see and feel the impacts, right? And hear it. And now they're seeing images generated and they're able to understand it. I think it allowed me to do is break a lot of that down into some more bite-sized pieces and create realistic comparisons for here's what it is, here's what it isn't, here's what we can do with it, here's what we can't quickly, which has been really great to have all that experience. And of course, clinicians, we all love to teach.
That's great. I totally agree with you. I think part of our responsibilities as CMIOs, informaticists, physician, is the part of educating. We're going to take not just clinical information, now technological information, and bring it to our young residents and medical students to advance their careers into the future. What we were medical students learning something new, we carried forward with us and evolved with the new technologies as little there was back then. Today, there's so much more that the residents and medical students have to engage with the technology to facilitate expertise in not just clinical practice, but a technological practice in healthcare. Shifting here a little bit around the EMR itself, how is leveraging the EMR and advancing those innovations around the improvements have improved you as a clinician, our patients, and really the healthcare networks you've worked with in the past?
I think a lot of the true impacts are things that are hard to measure as of right now. A lot of the improvement in diagnosing patient populations earlier, getting better diagnosis for risk stratifications of patients are a lot of things that a lot of people haven't seen or been aware of that are around now. I think when we take a lot of the EHR items, EHR, EMR, there are thousands of just software improvements in general that are maybe not all just AI that have taken us from nothing to exponential possibilities. And when you think about AI or EMR items, right? EMR, we took paper and we wanted to digitize the paper record. And so that was what I heard 10 years ago, 15 years ago, digitize the record. Great. And now it's a big old blob of a mess, right? And now all we have are all these companies. Everywhere you look, we can save time for doctors and nurses, and we're going to save time. Well, paper didn't take that long, right? And so we bloated everything way out. And then we created a whole industry of making it more streamlined. And I think that's great. Now I think we have AI tools that's going to allow us hopefully bring a lot of that together. And that's where we're seeing a lot of those advancements of data analytics, things that are showing workflow improvements, but we're able to not just come up with an idea of software and throw it out there or build it and then try to sell it to a hospital. What's happening is people are able to create something, make something. And now we're going to be able to estimate the impacts of what that is sooner and also be able to then implement things faster. When you think about being able to use Smart on Fire and more of these things that are finally coming together after a decade of talking about them, there's so many things I feel like AI is bringing the last piece of everything together to where it's going to now make even a much bigger improvement. Just being able to identify like patients at risk for social determinants, for example, just by capturing some of those thousands of data points we've had over the years.
I totally agree. That's a wonderful perspective. Any specifics of your success stories utilizing this innovation anywhere you worked in the past?
A lot of the success stories I see and hear are they're basic things. When I do work clinically, I work clinically as a hospitalist. So I'll discharge a patient or have a patient ready for discharge, and just being able to surface appropriate information for somebody who maybe wasn't able to afford food, didn't have the right transportation pieces, things that were caught in an interview way before in a hospitalization or in that intake, and they've been in the hospital for so long, millions of data points collected. But to be able to resurface the right information connected with the right patient to be able to get them the things they need, because if we know, and if we put it heads up, face up at the top, a lot of being able to get the right information connected from the right patient with the right clinician is what I'm seeing a lot of real impacts in. And I think that's where a lot of work we're going to be able to target and focus. So my example is finding patients that maybe have problems affording food. People have trouble affording transportation and be able to call those types of things out because we have resources, right? Everybody always says we throw money out. We have tons of resources and people don't use them. Well, it's really hard to find the resources and then figure out who qualifies for the resources, or thousands of drug programs out there. Okay, that's great. Those drug programs all have nuances and problems. And now a lot of these tools are helping us find the right person to the right program. And just by changing a medicine from one medicine to a different brand or different type of the same kind of medicine allows us to maybe get somebody a medicine that they couldn't afford otherwise for free. Like those kind of tiny things are what are going to ultimately make a bigger impact overall.
I agree. The human body has not changed very much since creation. And we've learned a lot about the pathology, the chemistry, the anatomy, the physiology of the human body. And we continue to advance our knowledge of it and ways to cure it. But all that knowledge already exists. How do you think AI can use that knowledge or be trained to use that knowledge in terms of driving that innovation with the EMR to provide you better knowledge at the time of discharge of that same patient, let's say a year from now?
The possibilities are endless. We just have to be careful overall. I think that we have so many items that are in what we call blob text or non-structured data. And all of those things require a lot of organization, and AI can help get some of those things. There's been things that have happened in the past that have failed, but now that we have so many millions of data points all coming in structured data points, right? We can gain a lot of information and actually make a lot of advancements for how we can start predicting or identifying trends and patterns for patients at risk of X, Y, or Z, type of not only disorders, but who's going to be at risk for readmission, who's going to be at risk for maybe putting patterns together for maybe we haven't finished the last part of the interview. Maybe if you have 1, 2, and 3 qualities, maybe you're going to be more at risk to have food insecurity. If you have certain demographics or you live in a certain area, maybe we're going to be able to predict food deserts. I mean, a lot of these things they're big things. Identifying osteoporosis risk earlier in certain populations versus another. And those are all things that millions of data points are going to allow us to bring together. And you're seeing thousands of different this and that topics all out there because we have so much more structured data now. And every day that goes by, I mean, there's millions more pieces of structured data coming in. That's where we're going to be able to really sift through all of everything and make massive improvements in clinical outcomes. I mean, and it's every avenue. It's not just one or another. I like to talk about like disparities and things, but I mean, it's also pneumonia treatment. I mean, it's common things as well.
Yes, I agree. I think the aspect of understanding what could be relies upon what we know and what we have to facilitate better use of. And right now, there is such a wide range of utilization of the EMR. Sometimes it is basic, sometimes it's quite advanced, predictive modeling, that kind of thing. Any areas of challenge that you come across that you feel that we have to really overcome to make the EMR and the integration of innovations equal for all clinicians to practice medicine, let alone take care of our patients?
The difficulty is that we have a large population of doctors, nurse practitioners, PAs, nurses, and those are all across all different technology levels, use case levels, adoption levels of the tools that are out there. I think we have a big challenge to overcome when it comes to make sure that we're all using the tools in the same way, to make sure that the usability of them are all there, but also that we don't, use one tool, one place and not have something like that to close a gap somewhere else. Like we get distracted often by the shiny new widget, right? And as everyone does. And I think that's where we have to be really careful because maybe not all providers at a certain place are going to use all of the tools that we put in front of them. And we have to make sure we're educating them and make sure that they understand the why behind it.
As your time as CHIO, any innovative successes you've been proud of creating within your practice?
In the role of CMIO or CHIO, we work so hard in so many meetings that just sometimes seem mindless, working with legal teams to explain things, working on governance, bringing together consensus on where the dot should go in the sentence and where an alert should pop up. But I think the big success I see is After a couple of years, you look back and you see how many different things that you did put in place. We had built a acute kidney injury alert, right? That was just something that was, I feel like I died on 5 or 6 hills for. But it really then highlighted in a patient with a change in their creatinine, it put it heads up, face up, and we were able to cut down vancomycin use or appropriate use. Seeing things like that, it's usually a lot of little things because medicine is so fast. But I think the most important thing that I see personally is just to be able to build trust among doctors. I think that a CMIO, CHIO role is really important. I think you've got to have somebody who can translate and having doctors building that trust in them to know that the docs say, hey, get Dr. Wyatt to come in. Maybe he can help this scenario when they're having some kind of problem because you can translate it, right? Not only they know you have their back as a doctor, as a clinician, but you're able to translate and speak all of whatever it is technically to get to the resolution of a problem quickly. And those kind of things allow you to kind of sift through all of the noise. I think that's probably my biggest achievement overall. And as a nurse, paramedic nurse, and a doctor, I think I argue inside of my head, I think with myself as I'm giving answers. So
I'm going to give you a title as a Sherpa. We're all climbing this Mount Everest and we need guidance, and your knowledge of that multi-tiered experience model is vital to help you not just explain to everyone who's taking care of those patients at every clinical area from EMS to ICU to primary care, but also allowing you to appreciate the experience that they have to undergo in order to facilitate and embrace and onboard and adopt the new technologies in a trusting manner. Trust is going to be important for this success. Trust by us in the technology, trust by our patients in us and in the technology, but also those who are learning this right off the bat, medical students and residents, they have to trust that we have an understanding of how to best deliver this new technology for their best experience, that they can take it and move that forward, healthcare forward as well. For the future of AI in healthcare, do you see any risks at this point that kind of bother you, or you say, you know what, we should be careful about this, especially around health equity and delivery models moving forward?
there's a lot of buzz, or not buzz, but talk about removing, and I know you and I have talked about this, removing some of these old risk models that are out there that include things like race that maybe were based on bad patterns, right? So just because people aren't getting treatment does not mean that they are more likely to, more likely to have a disease or less likely to have a disease, but it makes it more prevalent. It was a big point I think we saw with COVID around prevalence and incidence, and the statistics nerds, are all smiling right now because of that. But AI is taught by the data that we have. So we have to be really careful that if we build a model, we have to make sure we're building a model and then checking that model. If you're not familiar, a lot of the way that AI works, if it's going to spit out what's Al's, medical problem list, sure, there's something that generates it, but then there's a whole other AI that actually checks the first AI, right? So that's how they work. They check themselves based on referencing. AI reads it and then checks it against some kind of static whatever, the rules. And those rules are the things or principles, guiding principles are things we're going to have to make sure we're looking at to make sure we're not racist and we're not biased. And we have to try to make sure we are not falling on the same mistakes of chasing zebras. As I learned in residency, it's never the zebra. It never is. But making sure we're not looking for zebras, chasing zebras, but also that we're treating all the people the same based on the true scientific data we have. Because if we train it on subset information and try to apply that to other areas, you've seen what could happen in some of these. It's like it immediately becomes racist. It says poor people are more likely to die of disease. Well, yes, because they don't get treatment. So we just have to be careful with a lot of those things. It's a lot of stuff people are talking about, but we have to make sure we're bringing in all of those. Why are those items there? I think it's going to come in time. It's not something that's a doom and gloom and worry about, but it's that making sure in the beginning, in the next 2 years, that we're watching for those things and very cautious of those types of things, and making sure that we're all building appropriate governance. Because I think the worst thing and my biggest fear is that somebody's using something on their own phone that maybe isn't trusted. And because they think that it has AI attached to it and it's not a vetted, safe item, they're going to make really bad mistakes for that. And maybe people who are maybe not as educated in a certain area relying on things that aren't vetted and trusted, that's a big risk. And that's scary for me when I think about where we're at today and how fast things are moving.
Yeah, we don't want to accelerate bad outcomes because we have the hardware and the software to do so. We have to be careful in what goes in, therefore what comes out. An example was one of the clinicians looked at treating UTI and fluoroquinolones, great, but none of the other information about the patient being pregnant or a child was ever put into that algorithm. So therefore, guess what? You're going to have a bad outcome in 2 patients if you potentially use that same algorithm. So there's a lot of careful planning. And AI is still a small child relatively to all the knowledge we have as an aggregate of clinical care that we've developed. And let's face it, you're internal medicine, I'm emergency medicine. We know outside the box what it could be for a diagnosis, not just what we see in front of us. We have to think about that. And that comes from experience. 19 out of 20 times, yes, that is a chest pain rule out process, but there may be other things in the rarity that it may also be. So we have to be careful in doing that too. And hopefully AI becomes augmentation of the intelligence we have in clinical care and help us deliver that. One final question. Before Dr. Wyatt retires, what would you like to see healthcare to be?
So I think that it's kind of goes back to what you just said. I want healthcare to be something to where people know what they're getting when they show up to a place, right? I want someone to be able to go somewhere, and whether they can afford it or can't afford it, they know what they're getting. They know what they're going to receive when they go there. And I want there to be the way for people to be treated as people. And then, I mean, ideally, whether your opinion is everyone should get healthcare for all or not, that's, I think, been politicized. But I want healthcare to be healthcare. So it's focused on actually making people better and that anybody can get to it, right? So there's a path for everyone to get healthcare, whether that's virtual or whether that's in person, but also understanding what you'd be getting. I think all of the AI tools and everything that comes out there that's in the world, I think those are going to only exponentially get better. I think the medications are going to get bigger, better. But a lot of the items that you'd be able to use. So I think about every day, and this is kind of when I think about my North Star. Everybody always comes in and they say, well, I looked this up on the internet. And honestly, patients that are admitted when they're in the hospital are looking up what I'm saying right after I talk to them. And some of them, their mother, brother, cousin in the room is looking it up while I say it, right? And that's okay. I don't have a problem with it. Some people do. But I would love to have the Dr. Google, right, being able to give actual information and kind of going back to the point like you were saying, making sure that it had context of the patient in front of them. So that's exactly what happens when somebody Googles something, is that they don't see all of the other little matches of information, right? And it's almost like we need a match score for a piece of information. So I have a lump on my arm. Oh, it's cancer, right? Well, statistically, there's only a 0.2% match of my question and that answer being accurate. But if I have a lump in my breast and I'm this right age and I'm a female and it's been there, you tick all of the other boxes, then maybe that's a 75% chance that could be cancer. And you could see that more of it's a scoring of a confidence score, just like we use in medicine. I think AI needs that confidence score based on the information and pieces that it has, and being transparent to both whether you're using it as a clinician or I'm buying something off the street or using a Dr. Google type service, that if I'm an end user, I'd be able to see that. And that's what I mean by I say people get healthcare, because healthcare is going to be coming in every direction. Healthcare is going to, right now, you can make a phone call, you can go to a website and you can get some form of healthcare, right? But what I find more than anything, and horrible outcomes happen when people go to an online whatever service and they say they have a cough, and that's all they know about the person when they talk to a doctor on the other end. And guess what? you get treated for just that simple cough if you're not able to give them the rest of your medical history to know that you had pneumonia 4 weeks ago and that before that you had a lung biopsy. It's like you could have tons of other things that people don't know. And the interconnectedness of that, to even just call it out, I think that's where we're going to get connected data. We're going to get that transparency score. And then people are going to hopefully have the awareness of the healthcare that they're getting. So a long answer to get around to the same simple thing of just knowing the healthcare that you're getting and being able to have access to it.
Kendall, it's been a pleasure listening to you. You are definitely a major leader in our healthcare journey. You're a Sherpa for our future, and I wish you the best of luck in your career. And whoever calls you into those meetings will be very valuable information that you can give them and guide them for success. It's an honor to have you participate with us today in the AI on healthcare. And I hope you have an advanced and clinical experience in our industry. It's been a technical marvel to have you around us together. Working with you and working as a colleague of yours has been a tremendous pleasure. Thank you for joining us today, Dr. Kendall. To the rest of you, we look forward to seeing you all at our next town hall by This Week Health and Al's AI Insights.
Thanks for listening to this week's Town Hall. A big thanks to our hosts and content creators. We really couldn't do it without them. We hope that you're going to share this podcast with a peer or a friend. It's a great chance to discuss and even establish a mentoring relationship along the way. One way you can support the show is to subscribe and leave us a rating. That would be really appreciated.
Special thanks to today's episode sponsors Meditech and Dr. First.
Check them out at thisweekhealth.com/partners. Thanks for listening. That's all for now.